A child's birth is one of the unforgettable memories of a woman's life. One school of thought says it changes one's view of life. Truly, babies are answered prayers to their parents, and their smiles make life worth living for. From conception to birth, mothers take extra precaution so as to have a healthy baby. Certain foods and drinks are totally omitted from the expectant mother's diet. Regular antenatal visits ensure the needed multivitamins the mother and baby need are taken in order for the health of both. It is every mother's hope to have smooth delivery. Unfortunately for some parents, medical conditions occur leaving their precious ones with injuries and defects. It is believed that an average of 28,000 out of every 1 million birth injuries occur during birth annually. One may wonder what really the difference between birth defects and birth injuries is. Dr. Dallas Igbeko is a general medical practitioner with the Landmark Medical Center. He established the view that there is a vast difference between birth defects and birth injuries.
So, you see, birth abnormalities is a larger umbrella. Okay, yes. Abnormalities like that can exist before the baby is born. Okay, and birth injuries, I could say, are some form of birth abnormalities. Okay, because you could have, for example, a fracture. So a baby is born and has a fracture. That is an abnormality. Okay, so you could have the ones that exist before the baby is born, with congenital. So something like VSD, or people term as hole in heart. Yes, that is an example of an abnormality that existed before. Okay, you could have a baby born with a cleft lip or palate. Yes, so abnormality encompasses things that exist outside the normal before the baby was born or after the baby is born.
The treatment of birth injury may help manage long-term effects and improve quality of life of the baby. However, some injuries leave babies with lifelong mental or physical disabilities. Doctors have a duty to prevent birth injuries, and when they don't, it may be considered medical negligence. Most of these injuries do not need to be treated in order to heal. However, some injuries have no cure, meaning your child may have a disability for the rest of their lives.
The earlier, the better for the child. Many times, if we start when the child is very young, we can avoid surgery, and it's good for you and it's good for the child. So I would encourage you to do that. I'd also encourage you to come even if you think to yourself, I can't afford this. You can always come, you can call me.
The difference between birth defects and birth injuries has been established. What exactly are some of the conditions that constitute a birth defect and a birth injury on the other hand? Dr. Dallas Igbeko tells us more.
Birth injuries are injuries that could result from delivery of the baby, okay, by the mother, right? And there are several types of birth injuries, okay, and these birth injuries could affect different parts of the baby's body, right? So you could have birth injuries that affect the scalp, okay. We have one called Kefal hematoma. We have another that is caput succedaneum. Yes, these are types of birth injuries that affect the scalp or the head. Yeah, we could also have birth injuries that affect the nerves, okay, that are related to the neck and the upper limbs. So an example, we have the Erbs Palsy, and we have the clump case and prone paralysis. Yes, there's also birth injuries that are related to bones. So we are talking about fractures. Okay, so an example is fracture of the clavicle.
Realizing that your baby or young child is suffering from a severe birth injury can be upsetting to a family. Your thoughts and anticipations for the imminent future appear crushed. Paramount among the concerns will be concerns about your child's health and possible social life. Financial concerns may also arise. According to medical experts, birth injuries happen often than we are aware of. Most birth injuries are minor and heal quickly without any treatment. However, difficult deliveries and the presence of risk factors may increase the likelihood of more severe injuries. If complications are not dealt with swiftly, birth injuries may cause lifelong conditions and disabilities in some cases. In Ghana, a common yet less known birth injury among newborns is Erbs Palsy.
Erbs Palsy is a type of, I'll say, an obstetric brachial plexus palsy. Obstetric relating to childbirth. Palsy, some form of paralysis. Okay, and then the brachial plexus is a group of nerves that originates from the spinal cord. Okay, courses through the neck, through the axilla or the armpit into the upper limbs. Right. So it is a condition that is quite common. Okay, funny enough, and it comes about when there's a little injury to the nerves, this group of nerves. So the injury could be what we call a stretch or an avulsion or a pull, or it could be as a result of a rupture or a tear to this special group of nerves.
Dr. Gbeko gives us a brief history of Erbs Palsy condition and how the name came to be.
There was a British obstetrician called William Smellie in 1768. Yeah, he came up with the term after he realized one of the children, that came through vaginal delivery. It's mostly through vaginal delivery, anyways. Had some form of paralysis on both limbs, the upper limbs, right? And then two more neurologists, one French, he's Guillaume Duchenne. That's why it's sometimes called Erbs Duchenne palsy. Okay. And then there's, his name was Guillaume Duchenne, yes. And then the German is Wilhelm Erb. Okay. So that's how it became Erb Duchenne palsy, yes. So they did extensive work in terms of studying the behavior of these nerves, right? Okay. They found out that there are a number of these brachial plexus injuries. Okay, there's the Erbs, there's the clump case, paralysis that also affects a special group of nerves. They found that of all these brachial plexus injuries, the Erbs constitutes about 40 to 50%. So that's like half of the brachial plexus injuries. Right?
Erbs palsy, like any other medical condition, has got signs to look out for. However, some parents are either ignorant about these signs, whilst others believe that the condition of the child will get better as they grow. The ignorance of these parents can be largely attributed to the little knowledge and education about this medical condition. How can a mother know her baby has Erbs palsy?
With Erbs palsy, initially I said that it's a group of nerves that are affected. The nerves supply specific muscle groups in the upper limb. So they supply the muscles themselves and then the skin, right? So if it's going to affect the skin, it means that certain functions like loss of sensation become a problem first. Secondly, the muscle groups that are responsible for executing certain actions are affected. So when you look at the baby, okay, it is very obvious. Usually the baby moves the unaffected arm more. The affected arm is usually at one side. Okay, so I don't know, I wanted to illustrate how it looks, can I? So there's a problem with, okay, this is a rotation. This is a rotation, okay, right. If we split it into two, right, there's an imaginary line running just midline. Okay, if I rotate like this, it's more medial, caudal medial, that's towards the midline. If I rotate this way, it's lateral, away from the midline, right? This part of my arm has what we call flexors. Make me do this. I do this with my flexors, then these extend, right? Flexors, extensors, medial rotation, lateral rotation. So there's a problem with the lateral rotation. That means that the muscles work in antagonistic action. So if muscles are supposed to cause me to rotate laterally like this, and they are defective because of Erbs palsy, I tend to be like this. Okay. Again, this is what we call supine, and this is what we call prone. Okay. There's a problem in trying to get the arm in this posture. This is supine. So, first of all, they are medially rotated. Then there is pronation of the forearm. Then the wrist, what is supposed to make the wrist do extend like this is defective. So they flex. So it's something like this.
With the extra precaution that expectant mothers observe in order to have a safe delivery, the question still remains: what exactly is the cause of the condition in new babies, and how can it be avoided?
So there are a number of risk factors. Okay, we look at the baby's weight. Okay, typically the time is fetal microsomia. You have babies weighing 4 kilos or more. Yeah, so baby's weight prevents a smooth passage through the birth canal, and then we have a problem because coursing through in your mode of delivery, there's stretch. Okay, and that touches the nerve. Okay, there's another condition that's the shoulder dystocia. Okay, when the head is out and you're trying to deliver what we call the anterior shoulder, right? You apply some traction, okay, laterally, sideways. That also puts some force on the nerves. That can also result in Erbs palsy. There are other things we look at: maternal obesity, okay, gestational diabetes. Mothers who have gestational diabetes tend to have babies that could be big or small. In a situation where you have a baby that's big, then we could have a problem. Okay. Then we could also have issues with the presentation. For example, if it's a breech birth where you don't have the head coming, okay, that could also give us problems. So the breech presentation, or in an instance where the obstetrician has to use instruments to do the delivery, that too can affect the baby.
According to health experts, 13 out of every 100 babies may be prone to Erbs palsy condition. The severity of the injury of the nerves and the paralysis can either be resolved on its own over a period of months or require rehabilitative therapy or surgery. However, only 10% out of 100% of Erbs palsy cases will require surgery in order for the paralysis to heal. Most times, the ideal way of managing the Erbs palsy condition is through therapy. Therapy may be a rather long procedure, but equally effective and quite a cheaper option than surgery.
Definitely therapy. So surgery is a specialized surgery, right? Yes, and even in, like I said, I've not seen surgery yet because most of them recover spontaneously or through physiotherapy. Yes, in the Western world, Europe, yes, they will probably even have the equipment, the expertise for that. But I can imagine how much that will cost.
At every step of therapy, different techniques are adopted by the therapist in order to get the full function of the baby's arm before the baby is declared discharged.
We want to avoid movement of the shoulder. Yes, we want to avoid movement of the shoulder. So when the baby reports, we teach proper handling and positioning of the baby to avoid further injury. So we teach parents how to handle baby, how to hold their babies, like holding them at their rib cage and not under their armpits, and how to dress and undress the baby, how to clean the baby for like, let's say 2 weeks. Then we would ask them to come back. Then we start with mobilization. Yes, but there is a school of thought who also wouldn't go by this. They would start with mobilization straight away. But there is pain. That's why here we normally allow the let's say, should I say, the injury to heal for a while, like 2 weeks. We know that immobilizing the shoulder will let it heal for a while. So for like 2 weeks before we start with mobilization or moving on there. Also help the baby achieve appropriate age developmental milestone, like when it's time for the baby to sit, when it's time for the baby to roll, crawl, and even to walk. We take the baby through those stages so that it wouldn't delay or something. And also we help with the tactile stimulation, that mostly we tell the parents to use pushings like brushes to like rub it on the baby's affected arm to help improve sensation, like vibrators. And the baby starts to sit, then we help the baby to sit well. And they're scrolling, then we help the baby to bear more weights on the hands so that it will help with crawling. So and also how to hold objects, how to play with toys. We take the baby through all this. But for mobilization, we don't, and we will do it till the baby is discharged or right to the baby.
Meet Philomena. She is the mother of 8-month-old Wisdom. Baby Wisdom was diagnosed with Erbs Palsy after his mother went through a difficult delivery. Philomena tells us how she felt when she discovered her first baby has Erbs Palsy.
Just after delivery, and then the nurse told me that my baby's hand. So me, like, I was not having any idea about it, either it's Erbs Palsy or. So I think it was when they were about to discharge us, and then the nurse told me that my son is having Erbs Palsy. Yes, but she didn't explain to me what Erbs was until I came here. No, I was not having any idea about it. I didn't even know what it was. Yes. I was so sad. I was very, very sad. When she told me about it, I was having that positive thoughts, like he's going to be fine, and so I think nothing of that was going to my mind. As at the hospital, they didn't tell me like the cause, but just after delivery, the nurse told me that my child's hand.
So the nurse didn't tell you the cause?
Yes, either it's Erbs or she just said, when we saw and I was also feeling that I was the cause, because when I was delivering this baby, like during that time, I couldn't feel my leg.
The team will be spending his therapy day with him to observe his therapy section.
Wisdom second. Yeah, one of the babies I see for
So this is the mobilization
of the wrist. Also mobilize the elbow. Mobilize the individual joints as well. When I was explaining the condition, I made mention of certain words like immobilization, mobilization. I would like to demonstrate it with wisdom. So if you say immobilization, it's just an English word. Trying to avoid so much movement or trying to avoid movements. Mostly when the babies come, they are in pains especially pains at the shoulder. So we don't want to mobilize, so we put the hand in this position. Sometimes we pinch to avoid movement in the shoulder. And mobilization is when we start doing the passives. That's the range of motion exercise, which is moving the arm. Yeah, so like we tell the parents, this is the immobilization. We tell the parents to put the baby's arm in this position to avoid movements of the shoulder. Yes.
Even when we came, he couldn't even move the arm. He couldn't move it. When you take him, the arm it will just drop. So when we were asked to do that for 2 weeks, and then when we came here again, I think there is much improvement.
As Philomena, Baby Wisdom, and other babies continue their therapy sessions with the hopes of getting the full function of their arms back, we hope our little piece has enlightened you about this condition and what to do when your child is diagnosed with the condition.